So we finished with the blood flow through the chambers of the heart. Remember, 1, 2, 3, 4. And that's basically it. And here in the book, they're showing you way too many lines, but I think still okay. So then we have the coronary circulation. The coronary circulation is the circulation that is going to provide blood to your heart. So it's very important because at the moment that the heart does not have oxygen, the heart is going to suffer and it's going to die almost immediately. So it's very important to know how the heart gets the blood for nutritional purposes. Arterial supply, meaning all the arteries that you're going to have in your heart. There are two main arteries. As you can see, here is the right coronary artery that comes out of the aorta right here, as well as the left coronary artery. The left coronary artery, you can see here, is going to give you the circumflex, and it's going to go here, and then you're going to have the anterior interventricular branch. The right coronary artery will go to the back. That's why you see this is a posterior view. You can see here the right coronary artery again. Okay, it's going to give you the posterior interventricular branch right here. The veins, three main important veins, but I want you to pay attention to this part. You see, it's kind of like a small sac right here. It's called the coronary sinus. You're going to see why I'm showing you this. So let's take a look with a little bit more detail. Oh, before I continue, let's take a look how the blood supply of the heart is. So earlier, when we were talking about hemostasis, we were saying that sometimes the blood coagulates and forms, embolus, right? And these embolus are going to travel usually from the legs, and they may get stuck right here in these blood vessels. And again, if there's not enough branches for these blood vessels, so there's going to be some areas right here in the heart that are going to lack oxygen, and that's going to cause, best case scenario, angina, worst case scenario, a heart attack, right? It's going to be an infarct. So let's keep going down and let's see the branches. So right here you have the left coronary artery, and there are two main branches, the anterior interventricular branch as well as the circumflex branch. Let's take a look at the right coronary artery. Right here you have right coronary artery. It's going to give you the right marginal branch and with the posterior interventricular branch. Let's keep going down. Angina is pain that you get in your heart. A heart attack is the sudden death of an area of the myocardium due to an obstruction in coronary circulation. So veins, venous drainage. There are three main veins: great cardiac vein, posterior interventricular vein, left marginal vein, as well as the coronary sinus. These veins that you have, they're going to collect the blood from your heart, and eventually all three are going to dump the blood into the coronary sinus. The coronary sinus basically collects the blood from all these veins, and then the coronary sinus is going to dump all the blood from the heart into your right atrium.